Let's talk about social spending now. Some grants have gone up. The child support grant has increased by 20 Rand to 430 Rand or so. Some other small increases announced. And then the COVID-19 Relief of Distress grant has been extended for another year. This doesn't answer the question about whether or not there will be a basic income grant, which will be something not temporary, not seeing these ongoing extensions, but something permanent for the unemployed in South Africa. Let's chat now to Professor Lauren Graham, Director at the Centre for Social Development in Africa. Professor, thank you for being with us. Many are calling this a good news budget. On the social spending side, though, were you hoping for perhaps some more?
I actually think that this is a very balanced and good approach to the grants issue. I think it's good that we've seen some incremental increases in the grants. They tend not to keep up with inflation, and so looking at increases is important. And I think the extension of the SRD grant gives us another window, a year-long window in which to really make some informed and evidence-based decisions about what to do in terms of a more permanent solution in the longer term. So looking at how is that SRD grant being used, how is it being targeted, where are the income flows going, are all important questions for us to really have the evidence base to roll out a more permanent solution.
It does look like we are leading towards a basic income grant. It seems like the political will is rising. We're even hearing business groups calling for something a lot higher, something more substantial. Do you agree it is a fait accompli? It's just a matter of time?
I do think that to backtrack from the current SRD grant will be incredibly difficult. So there has to be some kind of permanent solution on the table, especially given the structural unemployment that we've seen, not just because of COVID, but as a long-term issue in this country, and because of the systemic nature of poverty. If we just look at food insecurity levels in households, that alone is enough to convince us of the need for some kind of basic income grant. But there's so many forms it could take depending on targeting. Is it a family grant? Is it an individual grant? What is the level it needs to be set at? How do we ensure that the right people are getting it? So there's a lot of questions we need to ask from a policy point of view before we can put something permanent in place.
Professor, you're saying government has a balanced approach here. Some people are talking about the risks not only to the economy but to society if we don't support the poor. And it's just incredible that we are in a position now where almost 1 in 2 South Africans are receiving some sort of support. Is it enough to stabilize South Africa as a society while we try and work towards getting that employment that we need, getting people in jobs, young people who are just desperate for that first job and are restless?
So I think it is a crucial part of the puzzle, but it's not the only part of the puzzle. And we did also see in the budget speech mention of allocations to the Employment Tax Incentive and the Presidential Employment Initiative, for instance, which are other important mechanisms to be boosting demand for labor. But I think the piece of the puzzle that we miss out on is that because the problem of poverty is multidimensional and it's systemic, income alone is insufficient. We need to be thinking about how do we complement income with other support services so that we unlock a number of the barriers that people living in poverty face, so that those grants, in addition to other services and interventions, become more transformative. Income is crucial, but it's an alleviation mechanism. It's not a transformative mechanism. We have to think about what do we need to complement those grants to help people exit poverty in the longer term. And that's partly about creating jobs and growing in the economy, but it's also about thinking about other aspects of poverty. There's mental health aspects, why do we have growing levels of discouragement, and how do we address that? It's about children in poorer schools not having access to things like adequate food and adequate health services. So how do we ensure that all of the pieces of the puzzle are working together sufficiently, that we're unlocking multiple barriers that people face?
And childcare that is effective to allow mothers to go to work and know that their children are safe. There's so many of those issues. And we're still talking about these huge allocations to education. That's crucial for the future. To health, poor people should be able to access good public hospitals. But what about the fact that the spending isn't always effective? Bigger allocations don't always mean better outcomes.
Absolutely. And that happens at multiple levels. We've got to be looking at how are these interventions and systems working at the local level, because that's really where the rubber hits the road with poor families. There's also obviously questions at provincial and national level, but if I just zone into local level, we've been doing some research on how do you strengthen systems around an individual school or in a local community to ensure, for instance, that children's well-being is being looked after from a multi-pronged approach. So how do we bring social workers, community nurses, teachers, etc., on board to really understand and address the well-being of children in primary schools? If we think about young people, how do we bring service providers together at the local level that they understand the challenges that young people face in transitioning to learning and earning, and we build those systems at the local level to work better for young people so that they're not falling through the cracks. And we're busy doing some research around how to do that effectively at the moment.
All right, thank you for your time tonight, Professor Lauren Graham, Director at the Centre for Social Development in Africa.